at work, and we would run into each other at the proverbial water cooler, or perhaps talking across cubicles or wherever it might be in the office. We would have these informal conversations among colleagues that can really move the needle in some exciting ways. And trying to outsmart the PowerPoint dynamic, we can kind of really quickly zoom out on. Instead, set up this idea of a cafecito meaning small coffee. Welcome to the CMEP, that is the California Mental Health Equity Project Technical and Training Assistance Center, Cafecito. My name is Dr. Eliana Ramirez. I'm the director of the CMEP TA Center. I am here with my esteemed colleague, Lucero Robles, who is part of CalMesa, one of several partner organizations on the CMEP TA Center. Welcome, Lucero. It's so nice to have you here.
Thank you. It's nice to be here.
I'm really excited for this conversation. I am a big fan of CalMesa. I am really excited that you're going to be sharing a little bit with the community about the work that CalMesa is doing and about your role on the CMEP TA Center. First, I'm going to start off by just sharing with our audience, in case there are any newbies out there, to introduce ourselves as the CMEP TA Center and to explain what we're doing here with this cafecito in the first place.
Perfect.
So CMEP TA Center is a newly funded project. We are tasked to support the county behavioral health departments and local CBOs in addressing mental health disparities across the state of California. In particular, we focus on the county cultural competence plans. And we provide no-cost TA, that's training and technical assistance, to the field. So I'm excited to invite anyone, everyone, your mother, dog, cat, and parakeet out there in audience land. If you have a question regarding cultural competence plans or addressing mental health disparities or achieving mental health equity across the state of California, please go to our CMEP TA Center website and submit a TA request. It takes just a couple of minutes. And when you do so, you can be paired with a subject matter expert like Lucero and her colleagues at CalMesa, as well as our other partner organizations. That TA could be anything from us coming in and doing a presentation to you and your colleagues, or providing consultation as you're developing your next CCP, that's County Cultural Competence Plan, or perhaps you would like some assistance thinking through how to use data for the ultimate goal of achieving health equity at the county level or in the community. Again, these are no-cost resources that are available to you. Additionally, as we start off our project here, we are really excited, honored, and particularly humbled to be engaging in this work around cultural competence plans. For those of you who might not know, the seeds for this work were actually started back in the 1980s. And so we've got several decades of very esteemed colleagues who have worked tirelessly on the county cultural competence plans. And we are thrilled to have the opportunity to work with all of you in envisioning the future of the CCPs. So we invite you to attend our listening sessions, which are coming up. We've got surveys. We really want to hear from you in the field to understand how best we might make recommendations to the California Department of Healthcare Services, DHCS, as they revise their guidance regarding the county cultural competence plans. So with that, I've given a little bit of background about the CMEP TA Center. I would now like to turn it over to you, Lucero, and invite you to share a little bit about yourself and the work of CalMesa with us.
Thank you, Eliana. My name is Lucero Robles, as you mentioned, and I'm a licensed clinical social worker. I am the director of quality assurance at the California Mental Health Services Authority, CalMesa for short. So we're very excited to be a part of the Community Mental Health Equity Project. So thank you very much for having us participate in this project. It's very important to us in terms of how we see where California is going, where we want California to go, and we are able to see the needs of our community through the lens of statewide initiatives or regional initiatives. I'll talk a little bit about CalMesa and what we do with that in mind. So Cal Mesa was first initiated, or its inception was as a result of the Mental Health Services Act. So, back in, I believe, 2007, maybe, don't quote me on the date, on the year, but I believe that's about the time. And it was really an effort to try and figure out the best way that not just fiscally, but that programs could be implemented on a statewide level that would benefit all of California. So as you know, in California, we have 58 states with 58 different populations, types and needs. So Cal Mesa came to be as a joint powers authority. So what we at Cal Mesa provide services or develop programs on behalf of counties. So we try to crowdsource or manage resources to use them in the most effective and efficient manner to help relieve the burden for the county so that they can do the work that's necessary to provide the services. And the services, when we talk about services for counties, we're talking about mental health and substance use disorder services. So we generally will refer to that as behavioral health. So I might be saying behavioral health instead of one or the other. So we try to, we develop programs that are statewide, regional, and we utilize the resources as much as possible so that we can affect the best programs to have the best outcomes for the people that we're all serving in California. So we know California is pretty diverse. There's lots of needs. And so the programs might need to be shifted a little bit depending on the region or the county. However, there are a lot of similarities as well in terms of the service delivery or the array of services that are delivered to beneficiaries, Medi-Cal beneficiaries through county systems. So I think that's a good stop.
It's so exciting to introduce you to the field through this cafecito. Whenever I think about social workers who approach this work, and especially from the quality improvement and data perspective that you bring, it's such a huge opportunity, I think, for behavioral health care systems and staff, because social workers, our training really is about the person and environment. We have an ecological approach to thinking about challenges and strengths in community. And the fact that you also bring that data and quality improvement side is just, it's really, really exciting. And it's one of the many reasons why we are thrilled to have Cal Mesa and your expertise on this project with us. You talked a little bit about how your Cal Mesa feels about being part of CMEP. And I wonder if you might talk a little bit more about some of the diversity that you were mentioning and similarities across those 58 counties from your perspective, having worked from Cal Mesa.
Yeah, thank you. So through the county mental health plans or behavioral health plans, there are specific services that are delivered to beneficiaries, Medi-Cal beneficiaries, services that are covered under these, under either the mental health plans or the substance use disorder plans. And so there's a layer of services, an array of services that are necessary and are required to be provided. Of course, the delivery of those services could change in terms of how they're delivered, depending on the population. In California, we know that our largest population of individuals who receive Medi-Cal services are predominantly Latinos. And we also know that through the many years of looking at data, there's been a lot of inequity in the delivery of those services. And it's difficult sometimes to reach those individuals. It's difficult sometimes to engage those individuals or also just keep them engaged once they are in service. So, we try to kind of look at what data can be used to talk about or to gear programs toward those populations or services that better meet the needs of those populations. So again, that's, trying to to narrow the health equity gap through data.
I am really appreciating that you're talking about data in that way, because one of the things that we've already heard is as counties are preparing their cultural competence plans, that there can be some challenges, honestly, with accessing data when it is held in different parts of a county behavioral health department. And then also the thought about how to utilize it for the county cultural competence plans. So this kind of leads me to my next question, which is, and I have a feeling it might involve data, but feel free to surprise me if I'm off kilter here. But just the idea of what kinds of TA requests do you feel like CalMesa is particularly well positioned to respond to that we might receive as the CMEP TA Center, again, for free, no cost, TA provided to the counties across the state? What are you guys most excited about receiving?
Yeah, I think that we are excited about using data to, again, inform the decisions that we're making when we're developing programs or when we do communicate with counties or other organizations. Because CalMesa is a joint powers authority and we are representing the 58 counties in California, it gives us a unique view of California, right? It's not narrow, it's actually, quite large. And we know that there, like you said earlier, there's data, it's just in different places. So how can we leverage the data to bring it together for more meaningful use of that data? And as you know, with data, and how do we get the most accurate data and most up-to-date data, to better meet the needs of the populations that we're serving, right? Because sometimes the data is so far back, 2-3 years, how beneficial is it then, trying to make a change now? A lot of things may have changed, and that data might no longer be as relevant anymore. So I think that the use of data is an important part of what we do at CalMesa. And we're looking at, again, all of California's 58 counties or regional areas as well.
One of the approaches that CMEP TA Center takes is being trauma-informed as well as diversity-oriented and strength-based. And so I just want to put out there to our audience, if you hear the word data and your eyes kind of gloss over, no shame in that whatsoever. That's a really common experience for many people. Many of us went through training programs, whether we are peer specialists or we're licensed clinicians, that may not have really spent more than a day or two or one class kind of looking at data and thinking critically about the data that we access. Like you were saying, Lucetta, like this idea of, is the data outdated to the point where it's maybe not as useful? If there are new variables that have come into play, for example, like COVID-19 or the wildfires or any of the other mega storms that have been happening this last year, my goodness, that can change the health disparities and health equity needs significantly very quickly. You mentioned the Latino community earlier, and we know that Latinos are having some of the highest impacts from COVID-19. We also know from the wildfires, because of where our communities tend to live, that we are the most vulnerable to those wildfires as they begin. And then if we don't have family in the area or we don't have community in the area, if we are, for example, part of a migrant farm working community, what are the implications then if we suddenly have lost our housing? And so I really appreciate what you talk about, that timeliness of the data, especially when there are major changes that come up like that. And I think another piece that I feel very passionately about is this idea of, when we use data, and talking about health equity issues, are we just saying, well, look, it's really great, the clients who come to access our services are reflective of the community? That's an important piece of information. I think also really important is for us to look at, what are the outcomes and how do the outcomes of different programs differentially affect communities? So are our Latinos having the same benefits at the end of getting through our program as, say, some other group? How is language impacting, or generational status, all sorts of different pieces? You know this better than I, so I'll stop for a second and see if you have any additional responses given the work of CalMesa on these topics.
Yeah, I like what you said, looking at whether or not people are accessing services and also the outcomes of those services. Is their health better? Are they better informed? Are they better able to take care of themselves or their significant others? But also, I think it's important to not just look at whether or not someone comes into service. It's what services are they accessing? Are they accessing the appropriate services? Are they accessing the appropriate amount of service, length of time? Did they get what they needed, to feel better, to be healthier? And how are they accessing those services? Because we might have an idea that, in the traditional sense, we might say you would get 6 months of therapy, 6 sessions of therapy, and that should do it, but people might need more or people might need less. Right. And so it's always important to kind of look at, are we providing the right dose or treatment, for the individuals, so that they get what they need, and checking in with them often and making sure that their needs are being met. The other point that you brought up is the fear of institutions, right? And especially for people of color in California, definitely the Latino population, with all, with immigration status, either themselves or other non-Hispanic populations as well. All of that impacts when, how they might access resources, or if they access them at all, right? So that fear will definitely play in. And what sort of outreach are we doing that can help engage those individuals in care and keep them in care as long as they need care?
My mind is honestly like popcorn right now, just responding to the things that you were just mentioning. And I am excited that this is just the beginning of our professional working relationship with one another, because there's so much that you brought up that can go on for longer conversations and these are conversations that need to happen. But I'm going to withhold from going further into the things that you're just sharing right now to be respectful of the time that this is intended to be a shorter conversation. But I imagine that the audience is also as kind of like at the edge of their seat as I am, thinking like, wow, you just raised like 5 to 10 super astute, pointed questions that are exactly the kinds of things that will help counties to think more critically or critically about data. And I want to acknowledge as well that many of the counties are already doing this great work. And one of the kind of secrets out there about TA that I like to share is that for me as a TA provider, I oftentimes learn just as much by being in community conversations with key stakeholders in the community. Want to recognize that the community-based organizations and the county behavioral health departments, and especially the ESMs, are experts in their own communities. They know best what's really going on a local level. And that's why when I say that I tend to learn a lot in communication during a TA request, it's from that level, because they bring that expertise, that perspective that you really can only get if you're super close to the community. And then we can bring in our expertise, like you were just saying, this critical approach to data collection. And I know that you mentioned before this idea of like, counties are unique in many ways, and there are some overarching themes that can be seen across the state. So I appreciate that that's an approach that you all take at Cal Mesa as well. Just in thought about our time, are there any closing pieces of information that you'd like to share, things that you feel most proud about or enthused regarding other work that Cal Mesa is doing right now?
Well, I'm very excited about all the work that's happening around California, right? Specifically with the California Advancing and Innovating Medi-Cal, so CalAIM. So there's a lot of efforts there on the state's side in trying to really bring counties together in a way and to better align services that better meet the needs of individuals without having the burden of all the paperwork, so to speak. Even though we're electronic, we still, old school people like myself will still call it paperwork, but that administrative burden sometimes that can bog things down. So there's a lot of effort and really putting the person before and thinking about what their needs might be and what's the best way and the best approaches to delivering those services. So like removing a lot of that red tape or just redundancy in some of the work that needs to be done at the local levels. Cal Mesa is implementing a peer certification program statewide on behalf of counties. So those counties that are interested and will be implementing the peer support specialist benefit might be represented by Cal Mesa. We're super excited about that. Again, an opportunity to kind of leverage the resources and to help California be more in line with standardizing processes so that the 58 counties don't have such a diversity where there isn't that need for diversity, right? So we're very excited about peer certification program, which will be live between May and July of 2022. So just in a few months. Yeah. So we're super excited about that. We're also excited about a multi-county electronic health record. So again, thinking about how best do we use data or information, right? So if we get scared about the use of data, like how do we use information in a most effective and efficient way, and building an electronic health record that does the work for you and meets the needs of the patient or client or beneficiary, but also the worker, right? So it's this ongoing balance and meets, of course, all the billing needs and all those things. But really looking at how can technology help us to get, to provide the services in a more efficient manner. And then we're also, of course, excited, or we've been supporting counties through some work with FEMA, with the wildfires, with COVID-19. So a lot of work there as well. So wherever we can step in, again, either local or regional or statewide, to again leverage the resources to maximize the outcomes. That's where we want to be, and we're very excited to be again a part of the Community Mental Health Equity Project to help revamp or relook at the cultural competency plans and what they mean and how they're used at the local levels to inform decisions about ongoing work. So we're very excited. I'm sure there's lots of other programs that I'm forgetting, so I do apologize to my colleagues for that. But we're also short in time, so but we're very excited at Cal Mesa to be a part of this particular project for sure. And just wanting to make sure that that we are present and that we are helping counties and in narrowing that equity gap.
I got to say, that was an impressive amount of information to pack into a pretty short conversation. Excellent job. And I can only imagine that your colleagues will be thrilled with what you were able to pack into this short conversation. So thank you so much for this Cafecito interview. For our audience, the idea of this Cafecito was just to have this informal conversation among colleagues. Even though we are working remotely, it's important for us to be able to just talk in an informal way with one another, because oftentimes this is where innovation will happen. When we just got to share our passions and what we're excited about with a colleague over a cup of coffee or a glass of water, whatever it might be. Yep. At this hour, I have water as well. So toast to you, Lucero, to Cal Mesa, and to the rest of the community. Thank you so much for being here. And to our audience, please do go to our website and submit a TA request. Thank you so much.
Thank you.